Did you know that there are daily habits that could be silently destroying your kidneys? Yes, you heard it right. In the United States alone, there are approximately 35.5 million people affected by kidney disease. And this number is consistently on the rise, not just within the United States, but also globally. To safeguard and maintain your kidney function, it is crucial to eliminate certain habits from your daily routine. Here, we present 8 habits that you should immediately cease in order to protect your kidney health. Number 1. Excessive salt intake. The excess salt puts a strain on your kidneys, leading to a chain of events that can have harmful effects. Firstly, your kidneys need to maintain a balance of electrolytes, including sodium, in your body. When there's an overload of sodium, it disrupts this delicate balance. Secondly, excessive salt intake leads to increased fluid retention in your body. Sodium attracts water, and when there's too much sodium, your body holds onto more water, causing fluid retention. This can increase blood volume and subsequently raise your blood pressure. High blood pressure, or hypertension, is a significant risk factor for kidney disease. The increased pressure on the blood vessels within the kidneys can damage their delicate filtering units called nephrons. Over time, this damage can impair their ability to filter waste products and excess fluids effectively. Furthermore, persistent high blood pressure can lead to a condition called chronic kidney disease, CKD. CKD is a progressive condition in which the kidneys gradually lose their function over time. If left untreated, it can progress to end-stage renal disease, ESRD, where the kidneys can no longer function adequately. Symptoms of kidney damage caused by excessive salt intake may not be immediately apparent. That's why it's often called the silent killer, since it can go unnoticed until it reaches an advanced stage. Number 2. Insufficient water intake. Your kidneys are responsible for filtering waste products, toxins, and excess fluids from your bloodstream. They help maintain the balance of electrolytes, regulate blood pressure, and produce urine to eliminate waste. But for all these tasks, your kidneys need an adequate supply of water. When you don't drink enough water, your kidneys don't receive the necessary hydration to function optimally. As a result, several issues can arise. One of the common problems that can occur due to insufficient water intake is the formation of kidney stones. Kidney stones are hard deposits that can develop when certain substances in your urine, such as calcium, oxalate, or uric acid, become concentrated. When there's not enough water to dilute these substances, they can crystallize and form stones. Additionally, your kidneys play a crucial role in eliminating waste products and toxins from your body. By drinking enough water, you provide your kidneys with the necessary fluid to efficiently carry out their waste elimination function. Water helps dilute urine, making it easier for your kidneys to filter and excrete waste products, maintaining a healthy balance in your body. So, how much water should you be drinking? As a general guideline, it is best to drink at least 8 cups, which is approximately 64 ounces of water per day. Number 3. Overuse of painkillers. When you take painkillers excessively or for prolonged periods, they can interfere with the normal blood flow to your kidneys. These medications work by blocking the production of certain chemicals called prostaglandins, which are involved in the regulation of blood flow to the kidneys. As a result, the reduced blood flow to the kidneys can impair their ability to function properly. Additionally, painkillers, especially non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, can cause direct damage to the delicate structures within the kidneys. Prolonged use or misuse of these medications can lead to a condition called analgesic nephropathy, which is characterized by inflammation and damage to the kidney tissues. Moreover, painkillers can also cause a decrease in urine production, leading to a buildup of waste products and toxins in the body. This accumulation can further strain the kidneys and increase the risk of kidney damage. Number 4. Excessive alcohol consumption. Alcohol is known to dehydrate the body, and when your kidneys lack proper hydration, they can't function optimally. Dehydration reduces blood flow to the kidneys, making it harder for them to effectively remove waste products and toxins from your body. Alcohol can directly damage the delicate structures of the kidneys. Over time, excessive alcohol consumption can cause inflammation and scarring of the kidney tissue, impairing their ability to function properly. This can lead to a condition known as alcoholic nephropathy, which can progress to chronic kidney disease if not addressed. Additionally, alcohol abuse can raise your blood pressure. High blood pressure is a significant risk factor for kidney disease. It damages the blood vessels in the kidneys and reduces their ability to filter waste effectively. If left unchecked, this can lead to kidney damage and even kidney failure. Number 5. Smoking. Smoking can have a detrimental impact on kidney health. The harmful chemicals present in cigarette smoke can directly damage the blood vessels that supply blood to the kidneys, leading to reduced blood flow and oxygen delivery. This impairs the kidney's ability to function optimally in filtering waste products and toxins from the bloodstream. Furthermore, smoking increases the risk of developing high blood pressure, which is a leading cause of kidney disease. Elevated blood pressure puts excessive strain on the blood vessels, including those within the kidneys, and can ultimately result in kidney damage or even kidney failure. In addition, smoking is associated with an increased risk of kidney cancer. The toxic substances in cigarette smoke can accumulate in the kidneys and promote the development of cancerous cells. Number 6. Excessive sugar consumption. Excessive sugar consumption can have a detrimental effect on your kidneys. When you consume high amounts of sugar, especially over a prolonged period, it can contribute to the development of diabetes, which is a leading cause of kidney disease. When blood sugar levels are consistently elevated, the blood vessels in the kidneys can become damaged. The kidneys are responsible for filtering waste and excess fluids from the bloodstream, but high blood sugar levels can impair their function. As a result, the kidneys may not be able to effectively filter waste products, leading to the accumulation of toxins in the body. Moreover, elevated blood sugar levels can also increase the risk of urinary tract infections, which can further damage the kidneys if left untreated. Additionally, diabetes-related complications such as high blood pressure can put additional strain on the kidneys, exacerbating the risk of kidney damage. Number 7. Lack of exercise. Lack of exercise can harm your kidneys in several ways. When you lead a sedentary lifestyle and don't engage in regular physical activity, it can contribute to obesity, high blood pressure, and diabetes, all of which are risk factors for kidney disease. Physical exercise plays a crucial role in maintaining healthy blood pressure levels. Regular exercise helps to improve blood circulation, which ensures an adequate supply of oxygen and nutrients to the kidneys. It also helps to regulate blood sugar levels, reducing the risk of diabetes, a condition that can damage the blood vessels in the kidneys. Moreover, exercise assists in weight management. Obesity puts extra stress on the kidneys and can lead to kidney-related problems over time. By engaging in regular physical activity, you can maintain a healthy weight and reduce the burden on your kidneys. And now, the most shocking habit at number 8, neglecting regular health checkups. Neglecting regular health checkups can have severe consequences for your kidney health. Many kidney diseases are asymptomatic in their early stages, meaning you won't experience any noticeable symptoms until the disease has progressed significantly. By the time symptoms appear, the damage to your kidneys may already be substantial. Regular checkups and screenings play a crucial role in detecting kidney issues early on. Through blood tests, urine tests, and imaging studies, healthcare professionals can assess the health of your kidneys and identify any potential problems. Early detection allows for timely intervention and treatment, preventing further damage and improving the chances of successful management. Additionally, regular checkups are essential if you have risk factors for kidney disease, such as a family history of kidney problems, high blood pressure, or diabetes. By neglecting these checkups, you're essentially putting your kidneys at risk without even realizing it. Remember, your kidneys are vital organs that deserve your attention and care. If you suspect any kidney-related issues or have concerns, always consult with a healthcare professional. Stay healthy and take care of your kidneys. Thank you, and we will see you in the next video.